Speak now to Matt McConnell, who's a researcher at Human Rights Watch, and he joins us now from Oakland, California. Welcome to the program. Tell us why Human Rights Watch is accusing the US government of violating the human rights of people that suffer with diabetes.
Sure, thank you for having me. So, Human Rights Watch found that the United States has failed to ensure that people with diabetes have equal and affordable access to the insulin they need to properly treat their health condition. We found that this is a violation of the right to health, and also it is a violation of the right to an adequate standard of living and other fundamental human rights, because when insulin is unaffordable, it causes people to have to ration the medication they need to live and to thrive. And it also has the result of causing people to forego other basic needs like their food and their rent in order to afford this medicine. Additionally, it has a disparate impact on communities that are socially and economically marginalized in the country.
And has diabetes and insulin in particular been a focus for the medical care in the US during the pandemic?
Sure. So there has been a lot of media coverage about the unaffordability of insulin in the United States, but a lot of the dynamics that produce the high prices for insulin are applicable to other drugs as well. Now, kind of going back to what you just said, diabetes is one of the seventh leading cause of death in the United States, and the leading cause of renal failure, lower limb amputation, and blindness among adults. And it also increases the likelihood of death for people who contract COVID-19. Without the insulin that people need to properly regulate their blood sugar, people can experience serious and even life-threatening complications that can increase risks for other health conditions, like similar to COVID-19.
And give us an idea of how much it costs to get the insulin a person needs for, let's say, a month.
Absolutely. So in the United States, we don't have a national health service or even a universal system of health insurance coverage. People who are uninsured, which is about 9% of the US population or 30 million people, and people who are underinsured, meaning that they may have health insurance through their employer or through the private market or even a publicly funded system, are going to have to pay out of pocket to access their insulin, either entirely or to a certain degree. These most commonly the most commonly prescribed forms of insulin in the United States cost more than $300 a vial, as you mentioned in your video. People who need insulin to regulate the blood sugar may require 2, 3, 4, 5 vials a month. So these costs can easily add up. I spoke to one gentleman who had health insurance, but had a deductible of $6,000 a year. So every single year he would hit his $6,000 deductible out of pocket just to cover the insulin for him and his daughter, despite having health insurance. For people who don't have health insurance, which is people who are much more likely to be coming from Black and brown communities in the United States, they have to pay out of pocket for that high price for these medicines.
That's a lot of money. Thank you so much, Matt McConnell from Human Rights Watch, live there for us from Oakland, California. Appreciate your time and analysis.